Question.
Thank you, Madam Speaker. My question is to the Minister for Health. Minister, 1 year into your government, nearly 5,000 public servants, including nurses, allied health, pharmacists and other frontline health workers, have voted against your EBA. 12 months on, with code yellows, staff shortages and exhausted clinicians, can you point to anything you've actually done to improve pay, fixed unsafe workloads or stop the exodus of health professionals?
Minister for Health.
Thank you, Madam Speaker, and I thank the member for Daly for the question. And when we talk about pay, we talk about conditions of service, and what we do know in the health system, Madam Speaker, is that our staff on the front line, and they've just demonstrated over the last 3 or 4 days in the middle of a cyclone, the commitment to their work right across the Northern Territory. But here in Darwin, Madam Speaker, we had roughly about 700 to 800 of our frontline staff bunkered down at the hospital in the middle of a cyclone, doing the job for Territorians, doing the job for the patients, the staff, visitors, looking after everybody in the health system. So for the member for Daly to come in here and talk about what's been done, what hasn't been done, is absolutely appalling, because we know that our health staff are facing the biggest battle here in the Northern Territory, because we are underfunded $200 million under the National Health Reform Agreement. $200 million. Now let's talk about aged care. 60 to 80 patients every day of the week are in our hospitals because they haven't got an aged care facility here in Darwin. We've had the federal member, we've had Labor talking about this for year on year. They promised $60 million in March, April this year. Has it been delivered? No. Well, of course it hasn't, because we've had the federal member for Solomon banging on about Audi rather than talking about...
Take your seat, please, Minister. What is your point of order, member for Daly?
Thank you, Madam Speaker. 110 relevance. My question was directly about the EBA negotiations, and I asked where they are at. Thank you, Madam Speaker.
Yes, can you make your comments relevant, please?
They are relevant, and what the member for Daly can't see, Madam Speaker, is the relevance between us being $400 million underfunded by the Commonwealth versus what he's expecting or what people are expecting to be paid in the health system. Now, if he can't see any direct correlation between us having $400 million short in the health system versus paying conditions for the staff, then something is seriously wrong. Because when we look at the health system, $200 million short under the National Health Reform Agreement, we're 6% behind the national average. The national average. There's no equity across the country when it comes to health funding. Now, $40 million a year we're spending on aged care, $51 million a year for the care flight contract. We're $95 million short when it comes to primary health care here in the Northern Territory.
Seat, please,
so
Minister.
When we talk about funding...
Take your seat, please, Minister. What's your point of order, Opposition Leader?
Standing Order 110, specifically about the EBA, which is the Northern Territory responsibility.
Please continue, Minister.
Thank you, Madam Speaker. And it's clear to me that you've got the Opposition Leader, the Deputy Opposition Leader, that can't see any correlation between the Northern Territory being underfunded $400 million versus paying conditions for staff here in the Northern Territory. Absolutely appalling. Coming in here, what you should be doing is advocating for more funding rather than coming in here and criticising our frontline staff. Get on the front foot and start asking for some funding.
So how do we get out of this mess? What's next here?
Yeah, our position for a long time now has been that there is structural mismanagement at a federal level of how we fund healthcare in the NT. We think we're about $400 million short, and that's not a made-up number, right? We've got hard facts to back that up. So we know, for example, hospital care in Australia is funded by your state or territory government and also the Commonwealth. Now, in the NT, the Commonwealth chip in about 31%, roughly around that number. The average across the country is closer to 38%. We're the lowest by a long margin. And yeah, that's 7%, but 7% is hundreds of millions of dollars. You know, we could have $200 million tomorrow if the feds just brought us to the average. We're not even asking for the most.
We just had a look at the extent of the damage here at Royal Darwin Hospital, and it's fair to say that this is a significant issue that must waken the federal government to understand that being deprived of $400 million a year is literally impacting the health and safety of not only Territorians, but of our staff who work tirelessly around the clock in hospital facilities right across the Territory. We are so blessed to not have any injuries coming out of this event, and we're so thankful to the doctors and the nurses and all of the staff here at Royal Darwin Hospital who have had to re-engineer the entire hospital to make sure that patient safety has not been compromised, and they've done that in the middle of a cyclone. It's an absolute credit to them, the hard work and determination they have for keeping the people of the Northern Territory safe.